it. Dear Chairman, ladies and gentlemen, I would like to present a report, ABCDE, vasodilator stress echocardiography in heart failure. In ABCDE protocol, A for regional wall motion abnormalities, ischemic or non-ischemic heart. B for B lines, wet or dry lung. An increase of B lines during stress greater or equal to is abnormal. C for left ventricular contractile reserve, weak or strong heart. Abnormal values for vasodilator stress echocardiography less than 1.1. D for Doppler flowmetry in coronary flow velocity reserve, warm or cold heart. Abnormal values less than 2.0, and E for ECG, slow or fast heart, abnormal values are less than 1.21. The aim of this study was to assess ABCDE findings during vasodilator stress echocardiography in healthy controls and non-ischemic heart failure patients with different resting echocardiographic ejection fraction. We recruited 428 patients with geographically normal coronary arteries. Group 1, 138 patients with heart failure and preserved ejection fraction. Group 2, 100 patients with heart failure and mid-range ejection fraction. Group 3, 180 patients with heart failure and reduced ejection fraction. And controls group, 75 healthy asymptomatic patients. All patients underwent vasodilator stress echocardiography with dipyridamole and passed the quality control reading for all imaging parameters, A, B, C, D, E. A stands for asynergy, included assessment of new or worsening regional wall motion abnormalities. B for B lines, an increase of B lines during stress greater or equal to is abnormal. C for left ventricular contractile reserve. It is stress-rest ratio of systolic blood pressure by cuff sphygmomanometer and systolic volume. D for coronary flow velocity reserve. It is stress-rest ratio of peak diastolic velocity on left anterior descending coronary artery. E based on heart rate reserve. It is peak stress-rest ratio. On this slide shows a non-ischemic, there are no regional wall motion abnormalities, strong contractile reserve more than 1.1, warm coronary flow velocity reserve more than 2.0, and rapid heart. On this slide shows a non-ischemic, weak contractile reserve less than 1.1, cold coronary flow velocity reserve less than 2.0, and slow heart. All positivity criteria except A were more prevalent in group 3 compared to group 2, in group 2 compared to group 1, in group 1 compared to controls group. In particular, in blood of heart rate reserve was found in 4% of controls group, 18% of group 1, 28% of group 2, 55% of group 3. In conclusion, ABCDE vasodilator stress echocardiography can help to identify the profound pathophysiological heterogeneity underlying a similar clinical presentation in patients with known or suspected heart failure with angiographically normal coronary arteries. These patients rarely show stress-induced regional wall motion abnormalities, but often exhibit pulmonary congestion, reduced myocardial functional reserve, altered coronary microcirculation, and cardiac autonomic dysfunction. B, C, D, E abnormalities are more frequent and more profound in heart failure reduced ejection fraction, least frequent and profound in heart failure preserved ejection fraction, with intermediate values in heart failure mid-range ejection fraction. Thank you for your attention.
Thank you for this very interesting and nice presentation. Comment, please.
Thank you for this presentation.